Hey everybody, this is Dr. Jay Greenstein coming to you from Chevy Chase, Maryland. I'm with my friend and colleague, Dr. Ben Newton. So, Ben, if you wouldn't mind, just tell the audience a little bit about your experience and your background, please.
Sure. So I hail from Utah, land of the free, home of the brave, all that fun stuff. I did a primary care residency in Vermont, and then went on to do a sports medicine fellowship in Cincinnati, and then continued on to do another fellowship in interventional orthopedics and regenerative medicine in Colorado. So I stayed there for a couple of years with those guys and then moved out east, and it's been fantastic out this way, and I like to just get into the musculoskeletal system. I really enjoy beating the crap out of myself and helping other people get back to doing what they want to do after they've done the same.
Yeah, that's great. So for the folks that don't really know about regenerative medicine, or what I call Regen Med, can you just tell people what that entails?
Yeah, sure. Regenerative medicine usually entails using your own body's stuff. So it's your blood products, which contain platelets and stem cells, to help yourself heal. So there's a lot of times that people, they've been runners, or they like to go out and beat on themselves biking, and then they just wear parts out. And some of us sit at a desk since we're in I don't know, grade school, we're sitting at a desk, our head gets forward, our posture kind of stinks, and things wear out unevenly. And so when that happens, people have pain, and they don't like to be in pain, and they don't want just a Band-Aid anymore. They want to get fixed. And so by using regenerative procedures, we're taking the body's stuff out, blood products, stem cells, what have you, and we're putting it back into the injured area to try to stimulate the immune system to respond and heal that spot.
It's great. I mean, we met several years back.
Yeah.
It's not often when I meet an MD who has the level of training and understanding around rehab and conservative care that you have. So I was like, wow, this dude knows his stuff. Like, we can work together and share patients, which we do, and it's been great, and patients love you and have been getting great outcomes. But when it comes to, choosing a conservative care provider, like finding someone who knows their stuff like you do, who's not going to do the invasive stuff, not going to do the Regen Med stuff, but more on the chiro, the PT side, what are the things that you look for? What do you recommend to our audience in terms of making a decision and finding a good, high-quality, evidence-based provider?
Yeah, I think the biggest part is do your research. It's the internet provides a milieu of I guess sites to stop at. Obviously, you can Google your area and zip code and find providers that do physical therapy or that do chiropractics. But if you're looking at someone who's, if you've got a shoulder issue, you want to go to someone who's got the sports background, who has not just the understanding of the injury, but also the tools to fix you. So chiropractic, physical therapists, hands-on folks that can actually adjust you, evaluate you, number one, and then put their hands on you to fix you. I mean, that's what I'm looking for. So a lot of times people will go to, they'll say, I don't want to do physical therapy because I'm on table 1 of 6. And the guy comes up and they tell me to do my 10 repetitions, and then as soon as I start on one, they turn to the next table and then the next table, and they leave me doing my 10 repetitions. I don't know if I'm doing them right.
Sure.
I don't know if it's... And so they stop going. And what I've liked about you guys and what people should be looking for is a personalized approach. Every problem is different. My shoulder pain and your shoulder pain are going to be different.
100%.
And so they need to be looked at different. That yours may tie into your neck. Mine may tie into my elbow. So you've got to be able to have somebody that knows how to look at that and say, hey, this is a unique person, and I'm going to give them the one-on-one attention that they deserve, and I'm going to have all of these different modalities to treat this problem, not just a plug and chug, here's the rehab protocol.
The protocol, right.
Yeah.
That's like the worst word in the world.
Yeah. Protocols, they're good for general assessment, but when you've been doing it as long as you have, and I'm trying to build my experience as well, as you can't treat people like an algorithm every time. It can't work that way. And so when you're looking for the right people, look at reviews. I mean, that can help. Go and talk to them. Sit down and with the expectation that you're going to not just have them tell you what to do. You're going to have questions for them like, well, how are you going to help me get my range of motion back? Or what's your approach to getting my strength back? And how long is this going to take? If they're signing you up for a revolving door of 6,200 visits, probably not the right idea.
Run for the door.
Yeah, probably not the idea. I mean, you want an end goal of like by 6 weeks or by 8 weeks, we want you 50% better or 90% better. That's helpful.
Yeah, for sure. That's great advice. And I love what you said about the assessment piece, because at the end of the day, we're not chasing pain. What we're doing is we're chasing the underlying functional and biomechanical issues that are causing the pain.
Yeah.
And those two things can be different. So
Absolutely.
it's important for the audience to know that.
Yeah, yeah.
You've been fantastic to work with. I've been a patient. I am a patient.
Yeah.
We're going to get back to that in just a second. But it's been a couple of months since we've chatted. So tell the audience like some of the latest and greatest developments in Regen Med right now.
I think a lot of regenerative medicine is a process of evolution. It's some of the names haven't changed. So you hear about PRP, platelet-rich plasma.
Yeah.
That's been around for many years now, but it's not the same as it was 5 years ago or even 10 years ago. The way we process it's different. What we're able to do with the processing. So we're able to make it quite concentrated or more dilute or a larger volume, depending on the person's problem, their age, maybe their sex, maybe the location of the body, and so those are things that are sort of newer over the past maybe several years. And now what we're trying to do is identify not only what the problem is correctly, but putting it exactly where it needs to go is again, it's been around for a couple of years. The ultrasounds, fluoroscopies, the fluoroscopies have been around for ages now. It seems like, and they that was good back in the day. But now we're marrying fluoroscopy with ultrasound, and we're even developing our abilities to can we use scopes inside the body? So instead of going and getting your knee sliced open, can we use a little scope that's designed for typically the wrist, but can we get in there in the knee and look at your knee and say, okay, that meniscus actually is torn. We're going to put stuff, the platelets or the stem cells right in that meniscus tear under direct visualization. That's the stuff that's coming. It's not quite here. It's been played with in the lab a lot, but it's not quite here. So we're looking at doing that. Obviously, you've heard of placental-derived growth factors and the umbilical derived growth factors and stem cells, and we're picking those apart. When new products come on the line, we have a lab that we can send stuff to. We belong to a consortium, a large consortium called Regenix. These guys have clinics all across the country, and we're trying to keep ourselves very high level. So if there's a new thing that comes on the market, a new centrifuge to process PRP and stem cells, we play with it, and we'll say, hey, does this thing work as good as our hand processed system works? And it's nice to see that we're still trying to stay ahead of the game, still trying to put ourselves out there. I think probably the newest thing that's come onto the market in the last maybe year or two has been the placenta stuff. Everybody advertises, hey, we do placenta stem cells, and we've dabbled in that quite a bit, and we've looked at the different companies that supply that, and we understand that growth factor media does not contain live stem cells, but it does contain a lot of growth factors. And so part of it is not just delivering the latest and greatest to the patient, like, oh, we've got placenta-derived growth factors or stem cells, but hey, what is in that solution, and should we really be delivering it to you? So it's education too, I guess is what I get down to, is we're trying to educate folks on our stem cells helpful or useful from another source. And I think, I guess the obvious thing for me is that we're refining our abilities to, when we do stem cell draws now, we're taking an amount of stem cells, and we're able to really get the nitty-gritty and get the most stem cells per cc for the patient. We're processing it by hand so that we're not missing little steps here and there. It's not getting contaminated. And we're also doing the platelets at a high level. So the newness thing to say, is there some one new thing? No, it's evolving, and that's probably the coolest thing about in your profession. You've seen how chiropractic has gone from just being maybe, okay, we adjust this and we adjust that. Now you're adjusting probably not just the neck, but the shoulder, the elbow. Maybe you've always been doing that, and I just am not well educated, but the way you're doing it, you have tools now, and you have beds, and it's not just bring them to that point and pop at the joint, and then forgive me for being, if I'm being all about it, but I think that we all in medicine, hopefully we're evolving, and maybe it's not this new crazy different thing, but it's what has existed has been refined. We really, that's what we're trying to do here all the time.
Continuous improvement, right? And the words that come to mind when I think about both of our organizations are research, innovation, and technology, and that drives improvement, and it's really cool. Like, it's fun to be in an industry that's evolving, where you're helping people. The evidence is really supporting what we're doing, and we're getting great outcomes with our patients, so that's what it's about.
I mean, I think a lot of folks try to throw that in our face a lot, like where's the
research?
where's the randomized controlled trial, double blinded, and all that stuff. And while they are developing those and they are coming out, that the numbers are small because we are. I mean, this is new science, and so we're building that. Over time, we're going to see that that bears out quite nicely, and that what we're doing is complementary to you, to the patient. That we all kind of add to the patient's lifestyle, bring it up a notch or two or three. Can we get them back to being pain free? Can we get them back to running or jogging or sleeping without pain? I mean, it takes multiple players and accurate diagnoses with the latest and greatest. I think we're getting there.
Yeah, multiple players. I really appreciate that statement, because we're in this opioid crisis, and it's safe to say that pain in our country, maybe around the world, has been mismanaged. So when I know we're working conservatively, and I've got someone that I can go to who's going to do what I'll call the more invasive stuff, but it's at least it's your own tissue. It's not drugs.
Yeah.
It doesn't have side effects.
Right.
It's all natural.
Yeah.
Like, it's just the perfect choice.
Yeah.
So it's great to have a solution like stem cell arts, and certainly you in particular.
Yeah.
So the fun thing is that a couple years ago I tore my Achilles tendon, had a great surgeon, Dr. Jim Gasho. Jim, if you're watching, great job. But I am older now, and I do have a little bit of a sequela. It's not as good as the right side.
Sure.
I tore my left Achilles. So what we're going to do is I'm going to come back to see Ben. He's going to do an evaluation. We're going to tape all of this. We're going to do a PRP session, right?
Yeah.
And then I'll come back for follow-up in 3 to 6 months, whatever you recommend.
Yeah.
And we're just going to follow my course of care, and we're going to demonstrate how great this technology, these treatments, and certainly how great Dr. Ben is. So any other final thoughts for our audience today, Ben?
No, keep an open mind. When you're looking at your own care, it used to be that you'd walk into the doc's office, and I think it was the doc said, bam, this is what you're going to get. Nowadays, people are driving their own care,
As they should.
So, and it should be that way.
Yeah.
And so, with the education that the patient has to look on the internet, find out kind of what they think's wrong. Keep an open mind when you walk into your office, my office, and if we say, hey, you feel the pain here in your front of your shoulder, but I think your neck may be causing this. We're not doing that just for our own health and fun. Like, we have experience, we want you to get better, and we may order tests that don't seem like they follow where the pain is, but our goal is to get you better, and so help us do our job, but keep an open mind, and we'll get you the best we can get. I mean, we're always shooting for, can we get you 100% better? I mean, that's the goal.
That is the goal. Thank you, Dr. Ben. Always great hanging out with you, and to our awesome tribe and audience. We will see you next time.